Awesome. Thank you everyone for joining. My name is Katie. Thank you for coming to the AAEM Women in EM IMG webinar series. Tonight we will be talking about all things fellowship with our host, Dr. Preston Hill. My co-host tonight is Shantae. Would you like to introduce yourself?
Absolutely. Hi, everyone. I'm Shantae, and it's a pleasure to be here with you, Dr. Hill, today.
Absolutely.
Awesome. Go ahead, Dr. Hill, if you'd like to introduce
Yeah,
yourself.
sure. So I'm Preston Hill. I'm a Ross graduate in 2016. Born and raised in Tyler, Texas, East Texas, and then did my undergraduate studies at Texas A&M, and then I did EMS for 2 years before starting medical school at Ross University in Dominica at the time, and then that would have been 2013, and then graduated in 2016. And then we can obviously, if you want, we can get in. Are we ready to go? You can tell me kind of the rest of the introduction.
Yeah, for sure. So talking about fellowships tonight, we kind of just wanted to start with how and when do you know if a fellowship is right for you?
Yeah, sure. And I'll just kind of speak to what we were talking about. So when I went to Ross, graduated Ross. I knew emergency medicine was exactly what I wanted to do. I was super fortunate. I did a lot of my rotations and clerkships in my fourth year at Kern Medical in Bakersfield, California, and that's where I was really exposed to emergency medicine. Ranked Kern Medical number one. I knew being a 4-year program, it was an additional year than some of the programs I'd been looking at. But I was super fortunate to kind of see exactly the training that they, were exposed to, and exactly, when you graduated, how well-rounded you were as a physician, as an emergency physician, really being able to kind of take on anything and everything. And really, when it came to residency, I looked for a place that I felt like I could, leave there and be competent, confident, and practice really anywhere and everywhere, across the country. And so, to your initial question, really, the way it transpired for me is it was during the COVID era, and so I kind of took a step back. We were doing rotations, so we would do community EM rotations at some of the private hospitals, and being exposed and around those physicians that were going through that time was very different than the academic physicians that I was working with at my home institution at Kern Medical. And what I mean by that is during COVID, the future was kind of unknown. There was a lot of hour reductions, pay reductions, things of that nature that you don't really think about, and you're residency training. You're really trying to think about when your residency, especially the third, fourth year, the latter end of your training, you start to think about where you want to be and exactly what that is going to look like in the future. And so I really was exposed to that, fortunately, and that's kind of when I had this epiphany that the academic physicians that I was around really had. You guys hear me?
Yes, we can. Yeah.
You there?
We can hear you.
All right, good. Sorry, that was breaking up. And so the academic physicians I was around, they had, for lack of better terms, they weren't sweating it, right? They had no hours reductions, no pay reduction. They were getting to teach just like they always were, no matter how many people came through the door, right? And so I really saw the security of academics and the opportunity of what that would look like in the future. And so that's where really my peak interest came from doing academics, was job security, honestly. And then I really kind of took a step back and looked at all the different fellowships and what I thought would truly make me a better emergency physician. And that was really the point of care ultrasound. And our program didn't have the best ultrasound education. And so my intention was to do a fellowship and then actually come back and be an ultrasound director where I initially trained. And really give back to that program and help, obviously, the future residents and training, graduates there. And so that's really where it came from. I will say that everyone does a fellowship for different reasons. I knew I wanted to teach. I knew that it was really what I enjoyed most. I was chief resident my fourth year, and I really enjoyed getting to teach the interns, the second years, the third years, right? Walking them through procedures and allowing them to grow underneath you, right? And that's really what an attending you get to do is kind of take a step back and learn how to teach and see these residents grow over a 3-year span or a 4-year span. and really kind of give back to the specialty of EM. And so that was really where it all came from for me. And then shortly thereafter, I kind of just thought to myself what I really enjoyed. And ultrasound was something I wasn't super, I wouldn't say not good at, but nonetheless, I wasn't exposed to a lot of it in my residency. And so I truly felt like it was a great way to make a difference in my patient care. And then also get to train and teach others across other GME programs, right? So, I mean, it's not point of care ultrasound is no longer isolated in only in the field of emergency medicine. It's across all specialties now, and everyone wants a teacher. And fortunately, in EM is where it all originated, and we really were the first to bring ultrasound to the bedside. And so we are the pioneers, and fortunately, the ultimate teachers. No matter what their specialty is. And so that was really kind of my the way I came on to a fellowship, and then more importantly, ultrasound, and really what I thought would be something that would prolong my career, right? And have this balance where I teach half the time, focus on the residency and the ultrasound training, and the other half, I obviously work my clinical hours. And so it's a great balance, a life balance that I think I could do for as long as I want to, versus in the community. I saw a lot of people also getting burned out, right? It's not uncommon no matter what your specialty, whether it's EM, critical care, all the ones that are high risk. It was a really good way to kind of stay an even keel and having a balanced career. And that was something that was important to me.
Nice. Thank you so much. You touched a bit on benefits of being a resident, so I'll kind of give you a two-parter. Part one, what additional benefits is it like having, being a fellow, being in fellowship, what additional benefits do you have? And second question is, how would you say you could be competitive for a fellowship? Like example, if you are interested in EMS, but you've never been an EMT, how do you give
Right.
yourself that cutting edge?
Yeah. So the first question you were breaking out to make sure was mostly the benefits of a fellowship. Is that what it was?
Yes. What are additional benefits of being in a fellowship? And the second part was how to be more competitive for fellowship. Let's say if you don't have that background experience.
Yeah. So first and foremost, the first question is extremely easy, because the biggest benefit, of course, is finding what your niche is, right? And saying, all right, this is exactly what I want to do. So in a fellowship, 50% of your time is dedicated to your fellowship, and so half the time you're going to be doing ultrasounds with residents, with medical students, and learning how to really teach any and all learners of ultrasound. Second is the other half, 50% you're working on shift as an attending, right? And so the other 50% of the time I was, working 80 hours in the emergency department as any other attending, as a graduate, right? So I just graduated residency, I'd done 4 years. And so day one, I was taking on PGY3s of their first day as a PGY3, and working attending shifts. And so it really allows you a great learning environment on how to be an attending, right? And you do that for an entire year, and it really allows you to use the system you're in as kind of a security blanket, because there's not really to read and say, hey, this is how you should be an attending. All you know is what you've seen, for better or worse. And so you're really using that year to kind of carve out how you want to practice, and how, more importantly, you want to be an attending for those residents. And so that's the biggest advantage is, you say you do a fellowship, and you think academics is not for me, you still get to take your fellowship training and apply that to another institution, or as a community physician, no matter what it is, say EMS, and say, okay, maybe I don't want to be in academics at this point in my career. I want to go work in the private sector as a community physician, and that's okay. But you just obviously spent a year of how to learn how to be an EM attending, which is vastly different than working in the community, right? I mean, I come into Tyler, there's not anyone here with with a lot of GME experience, and so there's residents that are working IM FM with these attendings, and these attendings have never been at a teaching institution outside of residency, which might have been 15 or 20 years ago, right? So learning the workflow efficiency, and then more importantly, how everyone learns differently, right? You got to adapt to your learners, and really understand that, rather than the learners adapting to each and every attending, right? So that's something that in fellowship you really get to hone in on and learn how to do that, and kind of take that as you take it in stride, as you are obviously nervous, anxious as an attending your first shift and your first month of work. But a lot of these institutions, they have fellows, multiple fellows. They've been doing it a long time, so they set you up for success, right? They're not going to put you in the most critical pod first shift, or they're not going to put you overnight by yourself. You're going to have opportunities. So that's something that's I think not thought of outside the box when you're looking at a fellowship, is the 50% of teaching and academics that you're going to do as an attending, and just learning how to teach and also practice medicine, given it's the first time you've been outside of residency. From EMS, I will say, so there's no one's going to consider you, lesser or, concerning that you haven't had any EMS experience. That's not a criteria or something. I mean, it will always maybe help you because you understand the lingo, you understand how to have those conversations. But really, when you're in residency, that's what's going to matter the most. Trying to do a elective, while you're in residency at an EMS fellowship institution, right? And making those connections and being able to experience what that would look like as a fellow, right? Same thing that I would have done in my residency, would do elective ultrasound rotation. Say I was at UC Davis in Sacramento, going up there as a resident, third year or second year, whatever, and getting that exposure. That's far more important than say a year or two in EMS like I was as an EMT, right? That's not going to help you, really achieve, that particular fellowship of your interest. So the biggest thing is during residency, trying to get exposed, make connections, go into conferences, and making those networking, so to speak. Hey, I'm a second year or third year. It's really going to be your second year, right? So it's either going to be your second year or third year. So we can kind of get into the timeline of fellowships. And so traditionally, it's always going to be in the fall, right? And so I applied, would have been September, October, and interviewed basically October, and then half of November, and then you match in November. So you don't have a lot of time that last year residency, whether it's your third year, fourth year, to kind of get all your ducks in a row, right? So you're really doing that on the back end of your second year, and then you're going to have a couple months to get your application together, and maybe do an elective before you apply and start your interview track, and really starting to try to figure out where you want to go. So it's mostly about those years in residency, right? Express your interest early. Say, I have an interest in ultrasound, or I have an interest in EMS, and really trying to figure out if your residency has connections in other places. And then more importantly, has anyone done a fellowship that was a graduate of that same institution, right? That's always going to be helpful to reach out to them, say, hey, how did you do it? What did you do? What are some good points that I could take and learn from to prepare myself in my application.
Awesome. Thank you. The next question we have is, we know that there's a lot of EM related specialties, and there's some more evolving. Some are ACGME accredited, some are not, some are just certificates. Are all of them kind of highly competitive? Not so much. Is it worth getting a certificate? What's your take on all of that?
Yeah, so the first and foremost, the most competitive was during COVID, right? And that was strictly because the community was not prepared and ready for new graduates. And so a lot of people thought that this time it was a great opportunity for them to double down on their training, and get fellowship trained, and wait for the EM market to bounce back, right? That was really where we saw the biggest influx. Traditionally, fellowships would match 50% of their spots. During the year that I matched, which would have been the year of 2021, I think it was like 87% that were all filled. And so it's vastly different, right? So that being said, I will say it's come back down, to where it was before. When it comes to, I would say, the competitiveness, it really depends on what you're trying to obtain, but more importantly, where you're trying to go. Right. So you'll know institutions that tend to take their own residents versus those that like to take outside, graduates from other programs. That's important. But for the most part, every fellowship is obtainable no matter what. Right. This isn't like surgery where it's like, oh, I want to do cardiothoracic. fellowship and, or plastics or orthopedics, something like that's very different. Like EM fellowships are far more obtainable than any other specialty, or even say in internal medicine, right? Trying to get cardiology, gastroenterology, or pulm crit, right? Those are, you're going to have friends that try for that and they don't get it. That's not really how EM is. EM, the majority of all people, like we had 7 graduate, I was the only one, despite it was a down year, to do a fellowship, right? And so it's not common for most people to do fellowship. So you will be, much prepared as long as you do your kind of homework early, and you'll have plenty of interviews, right? So as long as you have good letters of recommendation from your PD, obviously, say if you're doing ultrasound, you have one from an ultrasound director. If you do a rotation, away rotation for ultrasound, you'd hope to get one from their ultrasound director, or fellowship director, whoever it is. And then you put those together, you have good letters, you apply across the board, and you're going to have plenty of interviews. I mean, I think I applied, and it's very different, right? So residency, as we know, as IMGs, you kind of apply to 250, 300 programs, and you're hoping to get 10, 15 interviews, and you spend thousands of dollars. Yeah, fellowship's exactly the opposite, right? So I applied to 35 programs for $130, and I think I had like 25 interviews, right? And that was in a competitive year, and I was not that competitive an applicant from an ultrasound standpoint. Yes, I was chief resident. Yes, I had good letters, but no one was like, "Man, this guy is ultrasound ready," right? Like, no, like that was not my application. So it just kind of gives you an idea that you're going to be able to cast a wide net, but more importantly, you're going to get a good return, which is very different than how we experience residency and how we go through those applications. And so that's something that, you really can prepare yourself and obviously have a better idea of what's to come. And I know this was another question I think that we had talked about, or we saw on the list, was, thinking about where you want to go. Right. So when I was applying, I thought to myself, I came from a community, rough, rugged program, very traditional. It was, founded in the 70s, had everything we needed to be a good physician, but it wasn't an ivory tower. It wasn't a university. Right. So I had this chip on my shoulder, as a lot of Rossies do, is like, I want to go to where the university program is to see what those graduates, or what those residents look like. And so I really looked at all across the board. Like I applied mostly to all university programs, all academic tertiary referral centers, with the idea of like, I want to go there, see what it's like, and have that experience. And of course, that's going to pay its dividends in the end, right? When you create your CV and you're a graduate from a university program, that's what they're going to want most of the time, are going to want to see. And so that was something. More important than that also is, where do you want to practice when you're done, right? And so when I was doing fellowship, they weren't interested in adding additional ultrasound faculty, but if they had been, I know I would have had a job upon graduating, right? It's not uncommon for fellows to stay exactly where they are, right? It's essentially a year-long job interview, right? And so you've been there for a year as a fellow. If it's a good fit for you. They know if you're a good fit for them. So that's something that's super important, right? So as residency, we don't always get to choose, where we want to go, right? We rank, we fall to wherever our spot is, and we go, right? Fellowship, you can be how we all want to be and say, you know what, I put in this time, I deserve to go where I want. And that's where you can really use your fellowship to get yourself in the door into a program, maybe in a geographic region that you want to be in, or maybe this is the exact hospital you want to be in if they have a fellowship there. So that's a good example that I think is extremely important to when you're choosing. Think about, where do I want to practice in the long run? What's that center going to look like? And then more importantly, geographically, where do I want to land after I finish all my training? And that was something that I took into consideration, when I was obviously leaving the Central Valley to go to Northern California.
Nice. Thank you so much, Dr. Hill. That was a load of information and we really do appreciate it. So our next question is, what are some good questions you would say we should ask the program during interview season? And what is like the golden safety number that lets us know that we're definitely going to match into fellowship? How many interviews should we have?
Sure. I'd say first and foremost, going back to, you're going to ask very pointed, guided questions for your fellowship training, but also make sure you double back and ask a lot of pointed, guided questions for the time that you're going to be attending, right? And what I mean by that is, it's not common, but like I was a 4-year grad, so all doors were open, right? But say I was a 3-year grad and I was applying to a fellowship that had 4-year EM residents, right? So like that's awkward, right? So like as a 3-year grad, I'm walking in like, and they have it structured where it's like obviously you're not going to be an attending with a 4th-year resident and you're a new attending it from a 3-year program, but more importantly, really trying to understand what does it look like as an attending? Are you ever single, right? Single coverage as an attending, which you don't want to be, right? Especially I mean, not even in a community setting do you prefer to be a single coverage in the first, few years that you're practicing, but definitely not as an EM attending where you have residents and stuff that you're responsible for. So make sure you really kind of look at it from both perspectives, right? I think we would a lot of times, trying to figure out, are you going to be scudded as a new attending, right? Are you going to be working at the not at the academic center? You're going to be at the VA by yourself, working single coverage or something like that, versus getting to practice to be an attending. Super important if you want to do academics, right? So just remember that other half of it. As a fellowship, it really comes down to the resources they have, right? So like at UC Davis, like where I did fellowship, I knew that I was going to get to teach faculty, I was going to get to teach residents, and I was going to get to teach med students. That was important to me, right? So I knew that I was going to be prepared to teach any and every learner. And then more importantly, like from the, what's the curriculum look like, whether it's EMS, whether it's ultrasound, toxicology, addictions, on the rise now with fellowship. I mean, it goes on and on. Geriatrics, I have a friend that did that. Simulation and education, right? What's the curriculum look like? Because the biggest thing is early on, like when I was an ultrasound fellow, like the first few months, I was not prepared and ready. I would have not been prepared and ready to teach across the board all learners, right? I was still learning. It's like, how would I teach ultrasound when I'm just now beginning an ultrasound fellowship? Maybe like as an intern trying to teach, emergency medicine in the first 6 months. So making sure that they're going to take care of you, teach you, help you learn, get you up to speed, and then really help, with exposing you at the right time. And I think the other thing is, something to think about is one, how often have they filled their spots, right? That's always a good, if these things are 50%, a lot of these fellowships are 50% filled on a good year, a non-competitive where we are now, like you can imagine people know where the good fellowships are. You don't want to choose a fellowship off geographics and if it's core quality, right? So it's an easy question is like, okay, how many spots do you have, right? Because fellowship positions are not always set, right? So every year it might be 2 this year, and the next year they may only have funding for 1, right? So one, how many spots, and they may not know that during your interviews, but how many spots do you have for your EMS fellows? And then traditionally in the last 3 years, have you filled all those spots? Because if there's vacancies, it's not a red flag, but you can imagine if you talk to someone, they're like, we fill every spot every year. You're thinking to yourself like, okay, like there's obviously this fellowship's highly sought after, so that people are going back to that well and being fed versus if it has 6 years that it's been vacant, and you're choosing to step into that. One, what's that going to look like for you? And then two, are they going to be prepared to teach you despite they've had to get no fellows, right? Other things are, I would say, is what's the culture like, right? Like, and that's something across the board, whether it's residency, fellowship, whatever, but what's the relationship? That was something at UC Davis that I'm not sure I was extremely aware of, but the first month I was there, I always had an attending, come and introduce themselves. Hey, I saw you're working this pod. If you have any questions, I'm right around the corner. What's that look like? What's the relationship? Are you treated like a resident, that just graduated last night, or are you treated like an attending, right? Super important when it comes to you being a fellow and understanding, hey, I'm here to be a fellow, but I'm also here as an attending, and you want to be respected, right, for that as well. I'm trying to think other things when it comes to progression, right? So where are your fellows graduating and what jobs are they taking, right? It's super important, right? So like at the end of the day, when our ultrasound fellows at UC Davis, when we graduated, where were we going out into the workforce? Were we going to community? Were we going to academics? Were we using our skills? Were we not using our skills, right? So some people go to fellowship and they're like, yeah, I'm not sure I'm going to do this, right? I have a friend that literally was a year or two after me at Davis, and he still did ultrasound, and he's still kind of figuring out if he's going to use it, right? Which is crazy to think about because you've obviously invested that year, but it's not uncommon. So knowing where their graduates go is extremely important because it tells you how competitive you'll be when you graduate. Because a lot of times, like I said, people that do fellowship, it's kind of like residency. You have a higher likelihood to stay in that area. And so it's good to hear, yeah, we had a fellow that went across the street to this community shop. We had another fellow that stayed here the last 2 years. We've had one. And then, I mean, so then you have a better idea kind of where they're going and why they're choosing to do what they did. I'm trying to think anything else. Of course, pay. Fell in residency, we kind of just tuck our tail and say, all right, I'm stuck. Like you don't really get the opportunity. But fellowship, once again, the tables are slightly turned, right? You're wanted more than you want them. And so you can look at the pay and the salary and saying, hey, like, it should be a substantial boost from your last year in residency. But that's not going to be necessarily a deciding factor, but that's something that you want to take into consideration, knowing that you're being compensated well. And then also, can you supplement that, right? Can you moonlight while you're in fellowship, and can you work additional hours? They have shifts that are open on a regular basis that you can increase your hours to make more money, right? Because once you get a fellowship or once you get a residency, we all want to make as much money as possible to catch up. And fellowship's a good opportunity to do that, right? You don't want to go from residency where you're able to moonlight your last year and maybe you made an additional $40,000 and you get into fellowship and it's like a cut back, like where you get the bump, but you can't moonlight. And so you actually take a step back, right? And so you always want to know you can progress and have more opportunity and flexibility if you so choose, right? So not everybody in fellowship, like my colleague did not moonlight. She didn't want to moonlight, wasn't important to her. She kind of just doubled down on the fellowship, right? My weekends off, like if I had a weekend and I could, I'd drive back down to Central Valley and moonlight at places that I was moonlighting as a resident. And that was just important. Obviously, taking care of family and kids and stuff was just something that was important to me. So things like that are good questions. And then to hit on the ACGME, I know what Katie had asked. So the ACGME and the certificate. So I would never use that as a deciding factor or deciding point. And what I mean by that is, so the ACGME is who sets obviously which fellowships are accredited versus those that are not ACGME accredited. Then they'll get certificates, right? So ultrasound is a good example. We are not an ACGME accredited fellowship, right? But the ABEM, the American Board of Emergency Medicine, created what they call a focused practice designation, so FPD. And so they have basically, you get EM boarded and then you take a test to get a certificate that shows that you're competent in ultrasound. And ABEM did that to help protect ultrasound, right? So if I did a fellowship, I should obviously have some type of certificate or some type of credentials that sets me apart from someone that does EM residency that just carried a probe around and they're decent at ultrasound or even good at ultrasound, right? But they didn't do a fellowship. Like that's the way of that basically saying, hey, this person did a fellowship, this person did. But when it comes to it, those ACGME, the requirements are set by ACGME. There's not anything from our perspective as a trainee or going into that you're ever going to decide that being, okay, this one's ACGME and this one's not. When it comes to the particular fellowship, right? So whether it's EMS or toxicology. Now, if we're talking about the accreditation for like what's another accreditation is called UFAC, and that's what ultrasound is. So it's UFAC accredited. It's EUFAC. And so all fellowships now are essentially UFAC accredited. And that just basically makes sure that all these fellowships and programs are appropriately structured, that you're going to get educated. So that's the difference. It's not a big deal, right? So at the end of the day, if you choose to do toxicology, that's ACGME, right? Fellowship. So it's a 2-year fellowship. You're going to get, your boards at the very end and get your ACGME accredited, certificate, just like you would upon completion of your residency. But I wouldn't look at that to choose what you're passionate about, what you want to do long-term, whether it's ACGME or not, is not a big deal, right? Unless you're looking at fellowships inside the same specialty that have accreditation and not, that's totally different, right? You're always going to choose the ones that are accredited to make sure that you get a certificate upon completion, for when obviously you graduate.
Awesome. Thank you. No, that was something that I was actually going to ask later, but looking for
Oh, my bad.
No, you're good. You're good. And looking at how many spots are open for fellowships, I know it's kind of hard to see how many are actually available online. Some programs don't post that. So thank you for saying that. Our next question is, when a lot of us are in like the MS4s looking for residency programs right now. Obviously, it's nice if a residency program has a fellowship that we're interested in already. Sometimes that's not always the case. But looking at residencies, does the name of the residency really matter when it comes to fellowships? Like if you go to a big academic center versus a small community program, but does have resources in whatever specialty that you're interested in?
Yeah, no, that's a good question. And going back, so the NRMP, has the fellowships too. So you can look at that, right? So say that if you wanted to go look at ultrasound fellowships and who matched, right? So the ultrasound fellowship match is just like anything else. It's through the NRMP, and you'll see like UC Davis has 2 spots and how many they filled, right? And it'll probably I think it gives you like 3 years, like the last 3 years. So any of them that use the match, which pretty much is all ultrasound, that is obviously fellowships that are worth it. Toxicology, any of the ACGME, all of those are going to be on there too. But it's a good opportunity where you can kind of answer that question I was just talking about, where it's like, okay, you didn't fill in the last 2 years. Last year you could have filled 2, but you had 1, right? So it's a way for you to kind of go in and screen programs if that matters to you. So that data is out there and it's on the NRMP, which is the same, data that you'll get from residency and getting to see the residency programs and if they matched and filled all their spots too. And then next, sorry, what was your question? I apologize.
No, sorry, I asked too many questions at the same time. If, we're looking at residency programs that might not be an
Right.
academic facility, does a community program versus an academic facility really matter when it comes to applying for fellowship?
Yeah, I would say probably not. I can't answer that for sure. Depends on where you want to go, right? Uh, very different than say, once again, going back to like internal medicine fellowships, right? Like, if you're applying and want to do one of those, like you're hoping you get a residency at one of the institutions that has fellowships because you have a better opportunity. EM is not so much. Like I would choose residency based off the program specifically, how, what you're going to get out of that. I think that the fellowship aspect of things can come into it, and just simply by saying, "Hey, I'm interested in academics. I'm interested in particular fellowship. Have you had graduates walk into these, fellowships, in the last 3, 4 years, whatever?" But I don't. I would never think or feel as if you your residency is going to jeopardize or even could it help, sure, right, absolutely. I mean, it kind of goes back to what we said in the beginning. Like I don't believe that if you're somewhere without it, you still have an equal opportunity versus if you're there with it. Of course you're going to be exposed to fellows, you're going to be exposed to the fellowship director and have a better opportunity, but for the most part, I think it really comes down to exposure and structure that you're going to get an upper hand. It's not going to be that you're going to have a better opportunity if you didn't have that. I mean, I think it comes down to, I mean, the biggest thing about fellowship that I found was networking, right? It's very different than residency. Like residency is not about networking, right? It's not like who's who and who knows who or whatever connections. I'm sure that's out there, but being on both sides of the table now, like, for the most part, I never found an applicant and thought to myself, like, oh, they know so and so, or I met them at ASAP. Like, that's so far away, from what you traditionally would do in your residency. But fellowship's different, right? It's a fellowship. Once again, it's an easy way for academic centers to interview you for an entire year, right? They're always looking for junior faculty. They're always looking to continue to build. So why would they not say, hey, if someone has a connection to a fellowship director, say you're doing, your residency that has an EMS fellowship or an ultrasound fellowship, and your fellowship director for ultrasound or EMS, of course they're going to know the other fellowship directors in that state or in that surrounding area. So yes, that's going to give you a big boost when they can make a phone call or a text message, which is very different than say residency. But I don't think that if you go to a center that does not have it, like for instance where I trained, I don't believe that my training and then lack thereof when it came to the fellowships was a detriment to me. I felt like, you got to remember, I mean, this goes back to EM training too. Like, I could get on a soapbox about EM training. I think people choose EM residencies, especially us as IMGs, because we all come with these chips on our shoulders and we're always trying to jockey and prove ourselves. And that's great. We're competitors and I love it about us, but at the end of the day, some of the academic centers I've been at, I would put up some of our top graduates or our senior residents against any of these other institutions I've been at time and time again. And it's because a lot of it comes down to exposure, right? When you're at an academic center as a resident, the line is longer, the procedures are there, but there's more cooks in the kitchen, right? You're, far more opposed with a lot of other specialties. And then also you have fellows and all these things, right? So like we're at Kern where I was, we didn't have orthopedic residents. We had general surgery for a year, they closed down. And so we didn't have general surgery residents. So we did everything, right? It was very atypical. I'm not saying that's out there. A lot of programs that are like that out there, but I think fellowship can be similar. At the end of the day, you just want to know what kind of exposure you're going to get and get to cut your teeth a little bit. Far more important for your residency training than your fellowship training. But I really think as IMGs, a lot of times we look at the ivory tower and always think the grass is greener. And it's not true. I've been on both sides. I've been at multiple institutions now. It's just not true, right? And so really trying to delve in and get the details of these residencies and what you're going to look like after 3 years or 4 years of your training is far more important than being in the best city or being in the best location or being at an academic center. They're going to be able to sell you time and time again, but it's not always going to be the same type of training, because if they're consulting, for every fracture dislocation, if they're consulting for every peritonsillar abscess, right, and you're not doing it, then how are you going to be prepared to be an emergency physician, right? And I've seen that time and time again everywhere I've gone, right? The amount of consults that I have to put in versus when I was in residency, I just did it all myself, right? And you can bend the rules, but you can't break them. At the end of the day, if those rules are set, like you're not gonna be able to go in there. Like even like as a fellow, like I had done all the orthopedic stuff. And they're like, yeah, Dr. Hill, just do it. Like if you did it in residency, like who cares? I'm like, I'm a fellow. Like I'm not gonna like show up and go rogue. At this point, I was obviously on a job interview, right? So, but that's something in residency that you'll see, right? You'll always hear about it and talk about it. And there's a balance, right? I mean, you want the right center that's for you, but make sure that you're choosing it not based off of what you think is there, what you see, or the name. That you truly know that those residents or fellows are getting the training they need, to be competent and confident when they graduate. I think that's super important, no matter if we're talking residency or fellowship. But I've been on both sides. I've seen a lot. And if they're consulting for everyone, you're obviously not going to be well prepared when you graduate, because you're going to be consulting for orthopedics, this, that, and other, and versus getting to do a lot of that yourself.
Wow, that was some great information, Dr. Hill. You really came prepared tonight, and we do appreciate you so much. So as you know, in residency and when we're applying, two major factors are step one and our step two scores. How important is step three in the fellowship process? Does that matter, or is it kind of, all the work you've already put in before that score?
Yeah, I'm trying to. I think like I said, I had about 20 plus interviews, and I think one fellowship director or one interview, I was asked about my step three. That was it, right? So it's all going to be and that's why it kind of goes back. It really turns the tables, right? If as long as you have good letters of recommendation, you have something on your CV that demonstrates you've had this interest or passion for whatever it may be. That's going to obviously come to the forefront. Step three is not going to be discussed. It's just not something, as long as you passed it, right? If you failed it or they found a way to see that or ask for your scores, and that's one thing. But other than that, like if you know, obviously do extremely well on step two and you turn around and drop 20 points on step three, they're not going to look at that and be like, oh yeah, this person isn't prepared. It's just not that test that they're going to take into consideration. They're going to obviously weight your LORs and those types of things far more than step three. So I wouldn't say, obviously don't prepare or obviously don't, do as best as you can, but it's not uncommon for people to drop on a step three because the weight's just not there anymore, right? We obviously, set aside all these times and months to prepare for, step one or step two. And in residency, majority of programs are going to require you to take in your intern year, right? And so you have to take step three and within the first year. And so, you're going to set it up where you have an elective and a chill rotation, and you might get 30 solid days, right? To like have a half a day, for 30 days, which doesn't sound like a lot, compared to what we probably did for step two, but nonetheless, it's enough. And you'll go and you'll take it, you'll pass it, and you'll have an average score that you're like, oh, I probably should have studied more, but it's not going to come back, to obviously harm you in the flip side. So do well, study for it, take it seriously, but it's not something that I was ever. And like I said, I was in a competitive year, and only one person on the interview trail asked about my step three. So it wasn't something that, that was brought up ever or really often. So reassuring. I mean, the amount of judgment we get on our scores is nonsense, but it's good to know that step three doesn't play a role as much as the others.
Yeah, I've heard from a lot of people, at least that are not pursuing a fellowship, are, an EM, it's just pass it, of course.
Yeah,
So that's definitely reassuring after the months and months of studying for step one and step two.
absolutely.
Is there any other advice that you'd like to give us about considering a fellowship, pursuing a fellowship, or just any other advice before we open up for any questions?
Yeah, I would say the biggest thing is obviously it's just like going into your clerkships, right? We all have our own interests and our own agendas. But I would say the biggest thing is really going into it and trying to figure out like what are you passionate about? Right? It's so cliche to say, but EM as a specialty is extremely rewarding, but it's also extremely tasking. It's one of those that you put in a lot of work. Fortunately, you get to go home and don't have to worry about it. But nonetheless, like it is a grind. It's absolutely, I love our specialty, and but I also love the balance that I have with my fellowship training, and now that I get to teach, right? It's so much more important, and it allows me to get back into the emergency department and teach and walk through and more importantly, really appreciate where the training I got. So I think the biggest thing is go in with an open mind, during your residency, and really trying to figure out like because they're all so different. Like there's not really anything. I mean, I think it maybe addiction and like toxicology or some of those maybe, but for the most part, like they're so different. But once again, really try to look at it from how are you going to use this, as an individual clinician, and how are you going to use this to educate others, right? And I think that's the biggest thing of when you're looking at fellowships, and really understanding, how you'll be compensated for that, right? So EMS is a good example, right? So if you go and work in a private hospital as an emergency physician, right, you can obviously be a medical director for an EMS service, and you'll be directly compensated for that, right? But in academics, it's a little different, right? So anytime you're under a university umbrella or an academic umbrella, right, there's non-competes. It's far more obstacles, and so sometimes that money doesn't come directly back to your pocket. It actually goes to your institution's pocket, and it gives you what's called buy down. So instead of having to work 130 clinical hours, you now work 112 clinical hours or whatever that number is that you agree on. So that's important, right? So for instance, like at UT Tyler, I'll give you an example. So my contract is 0.5 FTE, right? So that's 50% of my hours are clinical hours, right? So I work 80 clinical hours a month, right? So 160 hours technically is full time at universities, right? Obviously, no one works. I mean, some people work 160 EM hours, but that's nonsense. But then the other 80 hours in my FTE is divided up, right? So I have 0.4 FTE for my residency, right? So I'm obviously trying to establish a residency, or 0.35, and then I have 0.25 that's dedicated to my ultrasound, right? So like ultrasound, I'm not going out. I mean, we can generate money by billing and stuff like that, but I am getting paid per hour for that FTE of residency focus as well as my ultrasound focus, right? And that's lumped into my salary as a W-2 employee, right? And so that's the thing that I think also you, as you're going through residency, really trying to figure out like, what's that going to look like? What is it, going to change in the future when it comes to compensation, right? Are you trying to use your fellowship to supplement? Or are you trying to use it to balance your life, if that makes sense, right? Are you going to go work 140 hours and then supplement your income with additional EMS, as a medical director? Or are you trying to go into a residency or go into an academic center and with having to work less clinical hours, but I have a salary of X amount, right? And that's something that, you don't know. And obviously it sounds daunting right now, but those are things that in residency you're looking at and trying to think about, like, what am I going to, how am I going to use this tool and what's it going to look like and how is it going to benefit me in the end? And that was where ultrasound really came in. I knew ultrasound was only on the rise across all GME programs. Every GME program wants ultrasound education, right? So I knew that I was going to have every institution I went to, I was going to be able to negotiate less amount of clinical hours and carved out time to provide that education for FM, IM, anesthesia, surgery, right? I mean, I teach all these residency. I go to didactics, do an hour lecture and an hour workshop of hands-on training, right? And every institution loves it, right? Because they don't have people to do that. And so that's really the things that I would say when it comes to fellowship, really trying to understand what's the life look like after the fact, not just during fellowship, because I think that will also help you choose something that is going to bode well for you and help you either make more money to supplement your income or better yet, have a more balanced life that you can do this for 30, 40 years or as long as you want and not have, to work every day in the emergency department to make money. Right. And I think that's really the way I looked at it was like, I love EM, but I also love my family and love everything else. And I want to have a balanced life where I get to do the best of both worlds. Right. And so that's really what academics has provided me when it comes to, ultrasound and how I teach and stuff. So.
No, that's awesome. Definitely sparked some more thoughts that weren't
Yeah.
even considering. And we don't get the business side of medicine also in med school. So, I know people say, "Oh, you'll learn that later," but you
Yeah.
know,
Yeah.
when is
Yeah.
later? So, no, thank you
Well,
for
let's set
explaining.
up a webinar. We'll set up a webinar. We can talk the business aspect of medicine and kind of like what your
Yeah.
contracts, what your contracts will look like. Because as a resident, you'll learn some of that in your residency, right? So especially as you're getting prepared to do interviews and these types of things, you'll start to go out on these, like to ASEP and, these guys, every recruiter's like wooing you left and right, but it's important to know what a W-2 employee looks like versus 1099, versus, hourly versus salary, and especially if you do a fellowship or especially if you're interested in academics, right? Like my academic contract is vastly different than my colleague who was a year after me is at UC Davis, right? Had I stayed at UC Davis compared to my contract now, vastly different, right? Like what they get compared to what I have when it comes to like the structure and the way I'm, compensated is tenfold better than what they have. And I'm not talking about numbers. I'm not talking about quantity of salary here. I'm talking about like I am compensated fairly for my time and for my teaching versus there it's like the buy down method. It's like, okay, well, you did geriatrics, so you get to be a geriatric director and you get 12 hours and you're like, that's a shift and a half. Like, okay, well, you know what I mean? That's how typical traditional academics does it. And so that's something that you'll learn as you obviously are going through your fellowship and where you are, you're like, oh, well, no wonder everybody here doesn't love their job or teaching because they're not truly compensated, right? So like kind of goes back to our teacher education. Like, I mean, educators just aren't compensated the way they should be, right? And it's no different in medicine, right? No different in academics. The traditional method is academic, physicians make less money than private, and they're just not compensated the same, right? But doesn't have to be that way, right? I've obviously worked at two institutions and been compensated extremely fairly both times, and been very fortunate. But there's also a little bit of trick to the trade as you learn more and more of how you're walking into these programs, depending on how it's structured and the contracts and the contract medical groups that typically, you'll come across in the future when you're in residency and your phone's blowing up, because they're like, hey, Katie, you ready to sign our contract? And you're like, I'm a year out. They're like, yeah, we'll start paying you now, per month. Sounds great, but what does all that entail, right? And so I'm happy to sit down. We can have another webinar and talk business and kind of the aspects of, what a community physician versus an academic, and then also kind of the in between of all that, because that world is always shifting. It's hard to keep up. It's not something that you need to lose sleep over tonight, but the more names, the more you've heard about it,
Right.
and the more educated you can ask the right questions, as you're going through residency to better prepare yourself, upon graduating. So.
Yeah, for sure. Does anybody have any questions before our time is up? I know we're getting down the end here. If you don't want to unmute, you can put it in the chat. I did post a link to IMRA that has all the different fellowship options, certificates, all the different concentrations in EM fellowships, if you guys would like to look at that. And if you ever come with any questions, Dr. Hill, do you mind putting your email address in if
Yeah,
anybody
sure.
has any questions that they think of later?
Absolutely. Yeah, it doesn't even have to be just fellowship driven, right? I mean, I've now obviously being an EM, I think it's one of those things that being on both sides. I did a lot of interviewing, when I was a resident and chief resident, and then as an APD, I did a ton of interviewing and screening, so I know what it entails, right? It's one of those, it's probably the most stressful time you'll go through when it's, application season, walking through these interviews and stuff. But even if it's about interview process and EM residencies or fellowships, any of that stuff, feel free always to reach out. I'm always happy to help and provide any perspective that I can that might be beneficial to, anyone at a MS4 level that's, preparing for that. So.
Awesome. Well, thank you, Dr. Hill, as always.
Sure.
Yes,
You're always awesome to give us talks and so much knowledge, and we really appreciate it.
Yeah, absolutely. And like I said, feel free. I mean, you have my number, reach out to me, and if we can set up another one in the future. And, I know you guys are busy, but as long as we can find a time that works, I'm happy to sit down and chat some more and help any way I can.
Yeah.
Thank you so much.
You're very welcome. Best of luck. And like I said, if you guys need anything, please reach out to me on my email, and I'm always happy to help.
Awesome.
Nice to
Good
meet you
night.
guys.
Thank you so much, Dr.
Thank
Hill.
you.
Absolutely. You're very welcome.